Getting your baseline investigation done is the first step. But menopause is not a one-time event. It is a transition which continues over years, and so your monitoring also should continue with it. Today I will tell you what to repeat, when and why, so that you can catch the change at the earliest. Annual blood tests every year, the same panel that we discussed earlier. These are annual health markers. Their value is in tracking the trend over years, not just reading them in isolation, and catch any change that occur at the earliest. Second and very important is annual doctor visit every year without exception, and this is not optional. At this visit, your doctor will be checking 4 things. 1 is your blood pressure, 2 is your BMI or waist circumference, 3rd is the clinical breast examination, and 4th is your clinical blood parameters. Number 3 is the pap test. A normal pap smear does not mean you are done. It means you are safe to wait 3 more years till the next one. So get a pap test done every 3 years if your previous report was normal. If the previous report was abnormal, your gynaec will advise a shorter interval. Do not assume a previous report normal means you can stop entirely. Mammogram. The guideline depends on your risk. Mammogram guidelines are not one size fits all, and this is important to understand. If you are a low risk individual with no personal history of breast cancer, no strong family history, no genetic markers, a mammogram every 2 years from the age of 40. If you are a high risk individual, first degree relative with a breast cancer, known BCRA gene mutation, previous biopsy, showing atypical cells or a dense breast tissue on previous mammogram, annual mammography is indicated from the age of 40 or even earlier, along with an MRI in some cases. If you are not sure of your risk category, this is exactly the conversation to have with your gynaec at your annual visit. DEXA scan or the bone mineral density scan. If your baseline DEXA at 45 was normal, repeat every 2 years while you are in the early postmenopausal transition. Once your reading are stable, you can repeat them every 3 to 5 years. But if your baseline showed osteopenia, a T-score between -1 and -2.5, repeat annually or every 2 years depending on the severity and whether treatment has begun. If your baseline showed osteoporosis, that means a T-score below -2.5, you should be on treatment and your DEXA should be repeated annually to monitor the treatment. And if you are on HRT, DEXA every 2 years to confirm that bone protection is working as expected. Menopause is a lifelong transition, and for it to be healthy, monitoring is essential. 1 annual blood panel, 1 annual doctor visit, pap smear every 3 years, mammogram based on your risk and